Esteemed viewers, have you ever assumed that more health checkups always mean better care? What if I revealed that, after a certain age, some of these tests could jeopardize your well-being? It might sound surprising, even unsettling, but the reality is that not all screenings are safe havens. In fact, some common checkups pushed on seniors can spark false alarms, pile on stress, and even lead to risky procedures that do more harm than good. This isn't about spreading fear. It's a growing realization among doctors, especially for those caring for patients over 70. The medical field is shifting, recognizing that a one-size-fits-all approach to testing can backfire as we age. In this video, we'll dive deep into 5 specific health checkups that seniors might be better off skipping. We'll uncover why these tests are so often recommended, the hidden dangers they pose, and smarter alternatives that protect your health without unnecessary risks. You deserve care that honors your age, your body, and your peace of mind. If you're passionate about staying healthy, yet wary of being over-tested or overwhelmed by today's healthcare system, this video is your guide. We're here to arm you with knowledge, boost your confidence, and paint a clearer picture of what truly supports you after 70. If this excites you, please comment 1 below. If it's a new perspective, drop a 0, and I'll refine our approach. We're counting down from number 5 to number 1. So let's get started. Your health journey awaits. What risks are lurking in your next checkup? Number 5 will open your eyes. Don't miss it. Subscribe now. Type 1 or 0. Let's hear you. Let's start with checkup number 5, a test that might sound reassuring but can misfire: the overuse of routine cardiac stress tests. For decades, the treadmill or chemical stress test has been a go-to for spotting heart issues, especially in older adults. The idea: push your heart and see how it holds up. But after 70, this logic can turn risky, often catching seniors off guard. What was a helpful tool in your 50s or 60s can become a questionable procedure, leading to more harm than benefit. The culprit? False positives. Results suggesting a heart problem when your heart is likely fine. As we age, our bodies transform naturally. Arteries stiffen, blood pressure varies, and heart rhythms shift. Normal changes that stress tests misread as red flags. This can trigger a cascade. Angiograms, catheterizations, even stents or bypass surgeries, each carrying real dangers like bleeding, kidney damage, or blood pressure drops. For seniors, recovery from these grows tougher and complications multiply. Take Harold, a 76-year-old grandfather from Illinois. Feeling great, walking daily, playing with grandkids, his doctor ordered a routine stress test just to be safe. A minor abnormality led to a catheterization, then a stent for non-urgent plaque. Soon after, blood thinners caused internal bleeding, landing him in the ICU for months. His vibrant life dimmed from one unneeded test. I've seen this pattern. Patients like Mrs. Clara, 73, pushed into procedures that stole her energy. Leading cardiologists now advise against routine tests for asymptomatic seniors, as evidence shows no reduction in heart attacks or mortality. Instead, focus on walks, balanced meals, and stress management. True heart supporters. If you're symptom-free, consider saying no. Test it. Reflect on your daily energy. If this resonates, comment 5 below. Next, a checkup that might pierce more than it protects. Heart health rethink needed? Number 4 digs deeper. Stay with me. Moving to checkup number 4, a procedure with growing concerns: the pitfalls of routine colonoscopies. Colon cancer's silent nature makes this test feel like a lifesaver, praised for years as a preventive cornerstone. But here's the shift. After 70, especially beyond, the risks often outweigh the benefits for many seniors. The procedure demands full sedation, and for older adults, anesthesia poses serious threats. Your liver slows drug metabolism, and your brain grows more sensitive, raising risks of post-operative cognitive dysfunction, lingering confusion or memory fog lasting weeks or months. Then there's the bowel prep, drinking potent laxatives to flush your system. For seniors, this can dehydrate, disrupt electrolytes, strain kidneys, and leave you drained, physically and emotionally. A misstep might mean dizziness or a fall, more common than you'd think, especially for those living alone. Meet Eileen, a 78-year-old retired teacher. With clean colonoscopies at 68 and 73, her doctor suggested another just to be safe at 78. During the procedure, her colon perforated, a rare but severe complication. Emergency surgery followed, and though she survived, her energy and independence faded. I've counseled patients like Mr. Raj, 75, who faced similar risks, losing vitality from routine tests. The benefit horizon matters. Polyps take 10 to 15 years to turn cancerous, a timeline often irrelevant past 70 with prior clean results. Watch for symptoms like weight loss or blood in stool. Otherwise, non-invasive stool tests may suffice. Reflect. Are you symptom-free? Comment 4 if this shifts your view. Next, a scan that might stir more trouble than peace. Rethinking colon care? Number 3 unveils a scan trap. Keep watching. Checkup number 3 is a seductive yet risky choice. The annual full-body scan mistake. The promise of a machine peering through you, catching every hidden issue, feels like proactive care, until it isn't. For seniors over 70, this can become a curse, triggering a domino effect of fear, invasive tests, and unnecessary surgeries that might shorten your life. Full-body CT scans and MRIs detect everything, harmless abnormalities included, turning minor findings into mental time bombs. A small nodule or shadow sparks follow-ups, biopsies, and specialists, chasing issues that may never matter. After the age of 70, your body responds differently. A biopsy that was routine at 45 can now risk a collapsed lung or infection. An MRI can exhaust or pain aging joints. Meet Betty, a 78-year-old woman I met at a senior health seminar. Vibrant, walking daily, no complaints. At a health fair, a mobile clinic offered a discounted full-body scan. They found a tiny lesion on her kidney, too small to cause issues and likely to remain silent. But the word lesion ignited panic. Within a month, she was in surgery. The aftermath? Months of recovery, drained energy, and lingering complications. I've seen cases like Mr. Ken, 77, trapped in worry from unnecessary scans. This is overdiagnosis, emotionally unnecessary fear. Full-body scans are rarely covered by insurance unless justified, leaving seniors paying out of pocket, thinking they're buying peace of mind. Instead, they enter a testing cycle that never ends. Trust your body more. Listen to how you feel, not just machines. Comment 3 if this holds value for you. Next, a colonoscopy trap that might harm more than heal. Wary of scans. Number 2 is a colonoscopy trap. Don't look away. Checkup number 2 is a procedure with hidden pitfalls. The colonoscopy trap. Long hailed as a gold standard for preventing colon cancer, this test has saved lives in younger years. But after 70, especially for those without symptoms or family history. It can quietly turn from protector to peril. What once safeguarded you in your 50s or 60s can, past a point, become a source of unnecessary risk, stress, and even hospitalization. Why? The procedure isn't minor. It involves full bowel prep, sedation, and a scope deep into your intestines, taxing even for the young, but far riskier for seniors. The bowel cleanse alone can cause severe dehydration and electrolyte imbalances, both hazardous for older bodies. Sedatives linger longer, leading to confusion, dizziness, and a heightened fall risk. Worse still, many over 75 face follow-up surgeries or treatments when a small polyp is found, often a growth that might never turn harmful. These slow-developing abnormalities take 10 to 15 years to become serious, a timeline irrelevant for someone in their 70s or 80s. Yet, discovery breeds fear, sparking a chain of biopsies, repeat scopes, or even partial bowel removals, all under the guise of prevention. When risks outweigh benefits, prevention becomes harm. Consider George, an 82-year-old friend of mine, active and sharp, convinced into a routine colonoscopy despite no digestive issues. He suffered severe dehydration during prep. Post-procedure grogginess led to a fall, fracturing his hip. Months of rehab, medical bills, and stress followed, for nothing, as the scope found no issues. I've witnessed this with Mrs. Ellen, 74, whose vitality waned after a similar ordeal. Doctors aren't to blame. They follow training. But medicine evolves, and so must we. If over 70 and symptom-free, it's reasonable to decline. Non-invasive stool tests offer a safer, more effective alternative. Stop assuming more testing equals better care. After 70, thoughtful choices often mean less intervention. Comment too if this changes your outlook. Next, a stress test that might strain more than strengthen. Dodging a trap? Number 1 tests your resolve. Stay tuned. Checkup number 1 is a test that can backfire. The overuse of cardiac stress tests. Heart disease feels like a ticking time bomb. Stories of sudden collapses drive us to catch issues early. That's why treadmill or chemical stress tests, monitoring your heart under pressure, are common, especially for those over 70. But here's the surprising truth. For many seniors, especially those without cardiac symptoms, these tests do more harm than good. The concept sounds comforting. Walk on a treadmill, track your heartbeat, and act as if something's off. But reality is complex. Most over 70 have age-related cardiovascular changes, mild artery stiffness, slight plaque, or slower recovery. Normal signs misread as red flags on a stress test. This can prompt further testing, angiograms, catheterizations, even stents, each with risks like bleeding, stroke, or kidney damage, especially in fragile older bodies. Once started, it's hard to stop. One test leads to a cascade of interventions for issues that might never trouble you. Meet Harold, a 76-year-old grandfather from Illinois. Feeling fine, walking daily, and playing with grandkids, his doctors suggested a stress test just to be sure. A minor abnormality led to a catheterization, then a stent for non-obstructive plaque. Blood thinners caused complications, landing him in the hospital with internal bleeding for 3 months. His quality of life never fully recovered. I've guided patients like Mrs. Jane, 75, through similar missteps, losing independence to unneeded procedures. Respected cardiologists now caution against routine tests for asymptomatic seniors, citing weak evidence for reducing heart attacks or mortality. Focus on quality. Daily walks, balanced diet, social ties, over chasing phantom risks. If no symptoms like chest pain or breathlessness, weigh the choice to decline. Comment 1 if this inspires you. Next, let's wrap up with a call to take charge. Ready to rethink testing? The conclusion empowers you. Don't leave. Esteemed viewers, what we've explored isn't just a list. It's a reflection of your life, your resilience, and the wisdom your journey has earned. Many believe that after 70, more checkups, more screenings, and more pills are the path to health. But sometimes, the bravest choice is doing less, not from neglect, but from discernment. Aging doesn't mean growing helpless. It's a time to question the system, to pause and ask, is this truly for me? Doctors act from training, often chasing disease rather than honoring health. But you hold the power to decide. Saying no to certain tests isn't ignoring your health. It's being deliberate, weighing benefits against burdens, and recognizing that not every scan or scope leads to clarity. Some lead into the maze of overdiagnosis, stealing your energy, joy, and connection. If this video made you pause and rethink, it's done its job. Share one insight you gained today and how you'll apply it. Your thoughts fuel us. Comment below. Your voice matters. If you found value, like, subscribe, and share with someone over 70 you care about. Your support keeps this content alive. Thank you for joining me. Stay wise, stay kind, and take charge of your health. Until next time, ready to lead your health? Type empowered and join the movement.